Want the two of us to decide?
I'm sure none of us in this room would want anyone on our team endangering patients in any way. As attendings, you're closest to the everyday workings of the ER.
So there is no hospital-wide policy?
Legal advises we handle it department by department.
So if we get sued, it's the individual attending's butt that's on the line?
Let me remind you, Dr. Greene, if we were aware that there was an HIV-positive healthcare worker here at County and the public got wind of it, started filing suits, all of our butts would be on the line.
So HIV-positive healthcare workers can be fired because the hospital doesn't want to be sued?
No. In Illinois, it's forbidden to fire any employee because they're HIV positive.
In theory, but people have been forced to quit.
Nobody's forcing anybody to quit.
What about restricting their duties to the point where they're no longer working within their job description?
I wouldn't presume to tell you two how to run your department, but to give you an idea of the current thinking, these are the CDC findings, Illinois state law and pending legal cases, and various NIH and journal reports. Now, look, I know you two have had your differences in the past. Do you think you can work together and solve this?
Absolutely.
Sure. So what if we change the disclosure form to include that people might be treated by an HIV-positive healthcare worker?
Start a witch hunt?
Well, we have to inform the patients. It's the law.
Look, I take it you haven't read this.
Americans with Disability Act? I don't know, what, proposals, addendum?
Here. Read this. It states that you can't disclose one risk without disclosing equal risks.
Meaning?
Meaning that the patient doesn't have a choice of whether they're treated by someone with the flu or someone with a hangover, a doc who just had a fight with his spouse, an intern who's been on for 2 days, someone with HIV.
Yeah, and Illinois law says that not only can we not prevent people from knowing that they've been put at risk, but we have to tell them.
So you'd rather follow the Illinois law than the federal statute?
You know, because I'm concerned doesn't mean I'm some kind of bigot.
You're concerned